While Marty's pulling up the presentation, hi everyone, it's a delight to be here. I invest in healthcare. I have a small health tech VC fund, first-time emerging manager. And in the 2 hours that I've been here this morning, I've already talked to 2 people who have amazing stories that remind me why we need to keep investing in groundbreaking innovation in healthcare. So kind of renewed vigor, and we're surrounded at JP Morgan by amazing stories of healthcare entrepreneurs and big companies. So it's a great place to be. Thanks again, Marty, for having me on the show. The name of my fund is Sugati Ventures. I focus on medtech, so medical devices and health tech platforms. As Marty mentioned, trying to move this.
Oh, no, you can't. I have to move it.
Oh, so just next slide, please. Yeah. So Sugati Ventures was created with the intent to take a lot of what I've done in the tech world and healthcare world and bring it together to start investing in companies that are going to change the landscape of tomorrow. And, when you talk about changing the landscape of healthcare, you have to bring a lot of players together. You've got to have groundbreaking entrepreneurs working on, amazing technologies. You've got to have big companies putting their might and power and money behind it. You need to have advocates working together. You need the voice of the patients, and you need managers in the middle like me trying to connect all the dots together and make sure that, the system works. And, we're just one keg in the entire system. But I think it's important to have VC fund managers in healthcare who have very different profiles. We need people who come from financial backgrounds. We need people who come from the healthcare business background. So my foray into healthcare was working with J&J, Johnson & Johnson, for 11 years. And that's what got me in love with healthcare. The healthcare fund that I'm focused on is really about medical devices. It's about health tech platforms. I'm an engineer by training, and finally, we're living in an era where technology is genuinely helping healthcare leapfrog, and it's taking it to the next generation. And when you talk about tech innovation helping healthcare, we're going to focus today on AI in healthcare. But I want to talk, before I jump into that, I want to say that there's a lot more innovation happening on the tech side, including things like material science coming into the area of tissue regeneration and really making tissue generation, tissue growth a reality, which we used to talk about 20 years ago, but we didn't see it happening. So there are other areas of tech that are truly helping, but the buzzwords, of course, of today are AI and Gen AI. So I would be remiss if I didn't talk about that at JP Morgan. So here we are. Next slide. Yeah, sorry, I'm out of habit.
Investment strategy?
We can skip this. I think that kind of... Yeah, so when I talk about AI in healthcare today, I want to have a very pragmatic approach to it. And I want this to be a discussion. I want you to challenge me or give me your opinions as well, because I think everybody in this room understands AI and the impact of AI in healthcare. But when I think about investing in AI in healthcare, I'd like to go back to the fundamentals of what AI till date has really been good at doing. Now, AI is going to do a lot more in the future, right? Things that are happening, the seeds for which are getting sown today, and we'll reap the benefits maybe in 10 years, maybe in 10 months. Who knows, right, about the speed. But AI is very good at repetitive tasks, right? It doesn't get tired, bored. And what it can do is it can learn with repetition. So it's not a mindless repetition. What it can do is with every new repetition, with data changing, it can learn and evolve so that the repetition is not a boring task that could be done endlessly, mindlessly. So it won't repeat the same mistakes over time, even in repetitive tasks, right? There's a lot of efficiency that comes with AI. There's a lot of signal flagging that can happen in large data sets that is very hard for humans to do. AI doesn't need to rest and sleep. That's true for technology and computation in general, to be honest. So that is always there. I think the limitation of AI today is really the computational ability of the machines that we're talking about and the availability of data and the cleanliness of the data. And I think that's very important, because if the data is biased and the data is dirty, your AI will perform accordingly, right? It still doesn't have that it's a strange word to use here, but it still doesn't have that human consciousness or gut feeling to actually flag out something like that. So that's a limitation, I would say. In healthcare, that translates into managing large data sets of electronic health records for patients and doing it with anonymity while keeping patient data privacy. When you look at how we age and how we grow over time, and as we do that, we accumulate some chronic or some really hard to handle diseases. There are trends and patterns that our life displays and our data displays, which are hard for even a very smart clinician to point out. But AI can really flag out those patterns, and it can start predicting what might be the course of treatment for you, but how your disease or your health or wellness might progress over time, considering things that you might not have considered given your genetic factors, given your race, given your epigenetics, the place where you live, the kind of mental health access you have or don't have in your society where you live in, right? Because these things change with culture, and that's epigenetics, and it has a huge impact on human health, which is now getting documented, and you can evolve and have patterns based on that. So there's a lot to leverage in those fields. I have a lot of examples of companies that I review in this field. I'll give you one example that I'm very, very happy to see happening. We all talk about, diversity and inclusion and health equity, and it's a very hard topic to solve in healthcare. I've invested in a company called Oatmeal Health. You can look it up. It's very, very early stage. That's what VCs tend to do. But that company takes a look at EHR from community centers, and it's able, based on a lot of this EHR and patient data and discussion notes between the patient and the clinician, it's able to flag out people who might be at a higher risk of certain kinds of cancers, but they're not diagnosed yet. So it can actually lead to flagging and saying that these people need to be screened earlier than the other population because they're at a higher risk. And not only is it able to help plan that screening, finding centers around the neighborhood that might have a slot available a month from now or a week from now, whatever it is. And once that's done, if it's discovered that they actually do have early onset of cancer, it'll help start planning their treatments because it again knows the treatment centers. It's able to see which insurance will pay for it, not pay for it, what will be out of pocket. So, and it may sound very trivial for all of us sitting in the room, but when you start going to underserved populations and communities, it's a real challenge. That's the challenge between life and death for them. And so now we finally start seeing AI solving these problems. And these are the kind of hard to solve access issues that AI can help with. Yes, please.
Can I ask you a question before you move on?
Of course, yeah.
Box, you're talking about AI here. So all this data is being collected actually since the dawn of telemedicine, which became mainstream with COVID. All this video data is collected. Huge volume. Is anything being done all with that, or is AI going to do anything with that? I mean, people didn't record your patient visits with a doctor or
Right.
People know me, know I live with a doctor, right? She has AI that records, that puts together the notes, but doesn't record everything, right? Yeah, so can't record. I mean, there's so much data, and I just wonder what's happening with all that.
So the beauty is that we have a lot of data. It's both structured and unstructured, so clean and dirty as well, right at the same time. The challenge with data is that it is not available to everyone. So there are still kingdoms and fiefdoms that hold this data. It's becoming less and less because the pressure from the public and the advocacy groups is increasing. That's a good thing. But a lot of this data set is owned by, let's say, the Epics of the world, right? That's not very uncommon because for the longest time ever, Epic has been the biggest EHR, ERP platform in hospital systems, right? Now you're starting to see a lot more competition. There's a lot of smaller companies that do EHR and ERP for like ambulatory surgery centers, which are becoming more and more. So there's a lot more diversification and a lot more competition now. As these kingdoms become smaller and as the competition in the data field increases, I think data will become more accessible. At this point, you can buy a lot of longitudinal healthcare study data sets from universities. There are certain country governments that are more open to sharing that with companies under certain conditions, right? For hard to solve health issues, right? Especially if these health issues are on the radar of the country. So for example, I'll give you an example of where I come from, right? I come from India. We are grossly predisposed to diabetes and blood pressure genetically, right? It's part of our history because we had 17 famines and 200 years of slavery, right? So that's what caused us to genetically evolve and store fat and sugar when we don't need to, and that leads to these issues, right? Now, if the government of India wants to resolve population health issues that are linked to our genetic background, they should be more open to, and I think with time they will become more open to sharing data with startups that are going after these healthcare issues. That's how you solve population health, right? Similarly, in US, we're such a melting pot. You have to understand the demographics, and AI can help you understand in San Francisco, which is uber healthy, uber vegan, uber vegetarian, and very freakish about running and healthcare and all of that. You could have a different kind of problem. We have more focus on mental health issues versus in Utah or Iowa, you could be worried more about cholesterol and obesity and other things, right? So AI can help you parse the data and let you know what the state government should focus on for population health in certain areas. That was a long-winded answer, but I hope that answered your question a little bit.
I'm just wondering if I recorded so much of my patient visits, why wouldn't I be able to pull it back like an accountant? See where I made mistakes.
I think my health system, I can't speak to every health system, but I go to the Sutter Health System. I'm able to look at my records that are there.
Right, but if you did telemedicine, would you be able to pull up your video?
Yeah, you don't record the video.
Yeah, that's the
They
thing.
don't maintain the video. No one takes it. So it goes to what you say, what you put in is your interpretation on what you see, that's the data that AI is going to see. Like all those divisions.
No.
They push the data that is.
Well, it's also a data storage challenge as much as it is about privacy. And the videos, if they're leaked, that's far more harmful than text being leaked and somebody having to interpret the text. You have a video, you can recognize the person instantly. So I think both the things are critical there.
I mean, among other things, right? Yeah, sure.
Yes, please.
Just a quick question. There is a lot of popularity around in the space now.
Mhm.
How do you differentiate and then how do you have some sort of your IP wall?
Mhm. So there are two things, because I'm looking at these companies from an investment lens as well as from an impact lens, right? IP, it's easier to have IP in, let's say, a molecule or a medical device. It's a little harder to have IP in software. So when I take a look at both my investment arms, I'm a little bit more stringent on IP on the medical device side. On the AI side, sometimes companies are leveraging AI that was built or open platform AI, so it's harder to have IP. They'll have fewer IPs there, and that's okay. From an investment perspective, regardless of whether you're a medical device or a health tech platform company, you have to understand very well as a founder how the money flows in the system. You have to really understand who's going to pay for the solution you're creating. 2 days ago, I was delighted to watch a conversation between a very young health tech platform entrepreneur and a very experienced health tech platform entrepreneur who was mentoring. And I was just standing there. I know both of them, brought them together. And the more experienced person was asking this very young person, so how will you get reimbursed? And the younger person made the mistake of saying, we'll figure it out. And off this person went. And that's exactly it, right? If you really do not know who's going to pay for the solution you're creating, then it's going to get very hard in healthcare because a lot of people think that self-pay can cover a lot of things for patients. If you add up one software platform on top of the other, how many things is a patient going to pay for? And if it becomes a self-pay, kind of solution, then you by default are not going to take it to people who are underprivileged, who have monetary issues. There are people who are trying to make ends meet in US, right? And Medicare is an never-ending battle in politics in our country, right? So how is self-pay actually going to work for these patients? So I think that to me is a very, very important lens, in addition to the IP.
So I mean, so, I have a lot of degrees, I've done in artificial intelligence, and I actually worked on natural language models back in many years ago. And so isn't there an opportunity in AI for dealing with people who might be on the fringes from a mental health point of view in terms of, person who's schizophrenic? We already actually have a firm that's presented many times here who provides beds for halfway houses, right? And they say that one of the ways they save money is not having the doctors are all remote, didn't have a doctor on staff, and that people are schizophrenic talk to the doctor better. It's almost like telemedicine for schizophrenics, right? But you would imagine that an AI would be able to interface because they have their own, they adopt any language model.
Mm-hmm.
Right?
So there's a lot that you're saying, and neuroscience is very close to my heart. And J&J, I used to work on neuroscience commercial, launching like depression and suicidality drugs and all. So what is now happening with AI and neuroscience particularly is that a lot of the biomarker research, as you were talking about, Marty, in neuroscience, hasn't panned out as well as you would want it to. So there's AI that can, if you put a patient in front of a camera with the AI, with the facial expressions and the movement of the eyes, a lot of the neurological disorders can be detected before the patients actually start showing symptoms, right? So AI
models that detect depression.
And so it's been better at detecting mental health issues than biomarkers, than other biomarkers, which is fascinating. And thank God there's a pathway to doing that. I mean, this topic is also very close to me because my dad has a slight form of dementia, and it went undetected for, I think, decades, where we would just, oh, he's just forgetting stuff, like, oh, he's retiring and he's like, just having a good time and forgetting stuff. No, that wasn't it. It was dementia. And had I paid attention, or others had pattern detection kind of techniques, it could have been detected very, very easily that he had dementia. And so, yeah, AI is helping do that. And you're absolutely right.
Right, I imagine Facebook messaging, any kind of emails you send, you detect all that stuff.
Sorry, there was a yes.
And so, I watch a lot of the TV where I'm also listening to my wife and reading the newspaper, streaming quotes. And so I leave the captions on.
Mm-hmm.
And one of the things I found is that, there's different accents, there's different lingos, especially on Bloomberg, where they have people from all around the world. So half the time I don't understand that, even though they're speaking English, you've got to really, really, really listen closely.
Right.
But neither does the translator, the person putting on the captions. So is AI smart enough to figure out all that? Because there's such a variance in the lingos and stuff like that.
I think AI is smart enough to do that. The reason why you still see those outdated translators there is because these companies have spent millions of dollars in building that infrastructure, and it's going to take a few strategy meetings in their C-suite before somebody says, okay, we got to reinvest and update these outdated systems. So part of it is legacy. It's not that the AI is not there. It's just that they haven't updated their systems yet. That's what it is. Okay, so one thing I'm really stoked about with AI is, as I mentioned before, DE&I, like true DE&I in clinical trials leading all the way to treatment pathways. We've been talking about it, big companies, small companies, governments for a very long time. But, diversity is of many, many kinds. Two people who might look similar might have very different genetic backgrounds, right? And historical pathways or epigenetic differences. And how do you actually incorporate all of that to make sure that the drugs that are being launched work effectively for the majority of the population with less harmful side effects? I have to stress on that because, and that transitions into population health issues, right? You can't prescribe the same drug with the same amount of, you have to do titrations to move the dosage up or down depending on people. Like, I'll give my example. I worked in Netherlands. I was a 5 foot petite person working with 6.3 feet tall and sometimes bulky men as well, right, in the tech industry. Now imagine the two of us going to the doctor for the same issue. If you give me the same amount of dosage, the amount of side effect I'm going to see that was given to my colleague who was 6'3", it's, I will not be able to get up, not because of the illness, but probably because of the side effect from my bed, right? And that thoughtfulness, our clinicians don't have the time. When they're seeing a patient for 10 minutes or 15 minutes, they don't necessarily, I see somebody nodding their heads. We could argue about that for years, but
Smart physician is very cognizant of that. It's been in the last 10, 15 years, it's been really emphasized. I mean, you're right. It's really hit the human beings before.
yes.
Right? In general, physicians are supposed to be cognizant.
No, I agree with that. Yeah.
They said that 30% of all prescriptions of generics is special ones.
It is not.
Special ones, in other words, it's just, they send it out for a special script, it's not just something you really can. They can put, either double dose or quarter dose, they might blend some drugs.
It also depends on the intensity of the disease, the stage. Yeah.
I think AI can give a sophistication because an AI can consider so many factors so much faster than even a very small physician. So I see him as kind of a screen perhaps. I can do this and make recommendations. And in time, because they keep at it, they'll get better and better. The simplest example is antihypertensives. Same medicine works very differently.
Yeah. And titration is, in neurological medication, right? In psychiatry especially, titration is the way to go. Like you got to figure out the individual strength and dosage for every patient. Oh, okay. Sorry.
Physician may think about 4 things while an AI system can consider hundreds.
Absolutely. Yes, exactly. Yeah. You had a question.
Has been working in this privacy. Let's give the right medicine to the right person, and then let's do a way better job of diagnosing every genetic disease since 1987. And we haven't made very much progress.
Mhm.
And part of the reason that we haven't made very much progress in using all the data that we actually have is because the users, and by that I mean researchers, clinical trial developers, physicians, and payers,
Mhm.
none of them have an incentive to really collectively use all the data that we have, nor are they allowed to, because as a society represented in our government, we still haven't gotten to a place where we feel comfortable allowing data to be shared. And then you add on to that the market pressure to hold things secret, whether it's codified by a patent or not, to hold things secret and private so that me and my investors maximize our
Yeah.
return on investment. So you have all these factors that work against driving towards health equity.
Yeah.
But we must get there if we're ever going to have a better health.
And we will. And I think one thing that I do want to talk about just for half a minute is that, we are seeing this trend of companies and advocacy groups pushing for saying the health data belongs to the patient. They have the right with the proper education to provide consent for either for it to be shared freely publicly or shared in parts for the things they care about, and they want to donate that data for research or even monetize the health data if so needed. And that's another era that I think some people are still resisting because they're used to an era where it was the data was held by the epics and the clinicians and the hospitals of the world, right? And so that shift, you can avoid it, you may not like it, but that shift is already happening with startups. And there are regulations being developed about it. So get used to it. And that's how data will be driven. So I think what you're talking about will change with that change, because if the infrastructure doesn't change, the patient will then choose the infrastructure that will accommodate what they need because they hold the power over their data. And that's when true change really happens. So it's a democracy after all. So.
I think there's an advantage for groups to work with the adversary groups that do have patients leaning in to provide their data, knowing that patient experience early on in trials before they make investments. I mean, it is legal insider information. Patient advocacy groups are putting that together.
I think it is absolutely the best idea to work with patient advocacy groups for two reasons. One, you get access to data with their consent, right? It's not without their consent. But what it does is you actually get closer to the patients. So you're not just hearing the sounds or the voices of the clinicians or the hospital systems or the payers, you're actually hearing what the patients are going through. And when you do that, it's hard to not design the better solutions, the better drugs, the better medical device, or whatever is needed to serve those patients. Something touches you. We're all human beings at the end of the day, right? And that's why healthcare is such a great place to be, because you don't have to wake up and say, is what I'm doing impactful or not? It is, absolutely. So 100%.
Fantastic. Well, great job. And Rachna will be at dinner. So thank you so much.
Thank you.